have already completed a consultation with your client, made them comfortable. You would have, notice I'm using the clean side of the cotton wool so that I don't cross-infect. You would have prepared a treatment plan. You know what your client needs from the treatment, so now what we're simply doing is the routine. If your client's cold, remember to keep them covered. Always keep the foot that you're not working on covered. You can apply the talcum powder to both feet for the warm-up, before or after the warm-up. What you need to be familiar with are the imaginary lines so that you can correctly position the organs. So keep in mind the diaphragm line, the heel line. This is where there is change of colour and texture. And then halfway through, and often you get a contour here, will be your waistline. So diaphragm line, heel line, I hope you're not ticklish, and waistline. To make sure you locate the correct organs, always remember these three imaginary lines and look at your longitudinal zones as well to locate. The main ones that we'll be looking for precision is the kidney, which is between zones 2 to 3 on the waistline. Zones 2 to 3 on the waistline. We'll have the adrenal above the waistline. Have the solar plexus on the diaphragm line. Remember your colon. We have the ascending colon, transverse, all the way across, continuing the transverse, down zone 4 for the descending and sigmoid. Okay. Above that we have the arms and shoulders, thyroid related, and eyes and ears. Okay, so both sides. The pituitary gland, pineal and hypothalamus, is where you get a slight protrusion and you will locate, as far as endocrine glands, the pituitary, the adrenal, and the ovaries uterus on the female, or prostate testes on the men. Okay. So once you're ready, you will apply your talcum powder if you want to use talcum powder for the warm-up, or you could just apply without. Okay. This warm-up shouldn't take longer than 2 to 3 minutes at the most for each foot. The first one's to wriggle the foot between your hands. Circle so that you gauge the flexibility of the joint, clockwise and anti-clockwise. The same for the toes, supporting well close to the toes, rotating and lifting the toe up above the socket. Clockwise, and anti-clockwise. You're going to use your fists to knuckle into the foot. What kind of pressure do you like?
Medium to firm.
Okay, is this kind of pressure firm enough, or would you like it firmer or lighter? Okay, so up and down. So press onto the solar plexus, press into the solar plexus and pull the foot towards you. Okay, so that you feel a nice stretch as well as a press into the solar plexus. The next move is possibly one of the hardest ones. That's the spinal twist. Fingers facing away from each other. Twist the spinal area. Okay. Don't be afraid to put the pressure unless your client has osteoporosis. Work all the way down and all the way back up. And then to check if your client's relaxed, some foot wave. Okay. Never lose contact with your client. Cover the foot and repeat. So I'm going to very quickly do wriggle of the foot, rotation of the entire ankle area, rotation of the toes, lifting the toes as you rotate, use your fist to knuckle into the client's foot, all the way down to the heel, and back up. Watch your supporting hand, that it's always opposite your working hand. So note my supporting hand moves up together with my working hand. Thumbs on the solar plexus, push in and pull the toes towards you. Spinal twist. So that you get a nice twist of the spinal reflex. And foot wave. And what you can do is at this stage pinpoint into all the endocrine glands. So warn your client that it may be a little bit tender. Start off with the pituitary, pineal and hypothalamus. Remember, this is the Joe Riley method of hooking in. Pinch. Okay. Just once or twice. If it's a little bit sore, give it a bit of a rub. Then hook into the adrenal. Client will get the same kind of sensation. And the same with the ovaries, uterus for the female, or prostate and testes for the male. Hook in. If it's tender, give it a little bit of a rub and onto the other foot. Don't worry if this foot remains uncovered at this stage, because you're only going to be for a fraction of a minute on the other foot. So hook into the pituitary, pineal, hypothalamus, hook into the adrenal, and hook into the ovaries, uterus, or prostate, testes on the male. This is where you get the indentation here at the bottom. Okay. Once you've done that, we're going to do some breathing to relax the client. Thumbs on the solar plexus, and you ask the client to take deep breaths as you push in. So client inhales as you push in and exhales as you relax. Because we're demonstrating, I'm simply going to do 3, and then we'd be ready to start. I suggest you start on the right foot. This means your client's right foot, and this is so that when we come to doing the colon, you're on the correct side where the ileocecal valve is. You will need to have plenty of talcum powder, and you will need to gauge the pressure that your client wants. At this stage, I suggest that you demonstrate your pressures to your clients and say, okay, this is my light, this is my medium, and this is my firm pressure. So this would be my light pressure, okay? This would be my medium, and this would be my firm, okay? And which one? Medium, okay. So I'm just going to demonstrate with a medium pressure. We're going to start off on the toes, which is the head. We'll start off the top, the base, up the back of each toe, making sure you don't miss the sides of the toes, and then down the front. So we complete individual one toe and then work on to the next. Always support as close to the work area as possible. We're going to start caterpillar walking the top of the head, the root of the toe, which is the neck thyroid area. Keep an eye on your client's facial reactions. If they're in pain, you'll need to ease the pressure. Or if they want it firmer, you can adjust. So you've been across the top, across the base, and now we're going to come up the toes, making sure you start beneath the root of the toe so you don't miss the neck. Right underneath, really feel what's underneath the skin. If you don't stretch properly, you'll be working simply the skin rather than the reflexes. So you need to get really deep into the reflexes. Work your way across. Is the pressure still okay, or would you like it lighter or firmer?
But this area is very painful.
Okay, so I'll be a bit gentle on this area. Make sure you go right inside. And then pull the toe towards you and work the front. I suggest you also work the toenail, since this represents the hair and the top of the scalp. So if a client has problems with hair growth, perhaps you can work the nail. Small caterpillar walks all the way down to the root of the toes. I suggest you go over at least once over every area, and possibly 2. And if there's a problem, especially further down the body, you could work up to about 6 times over the same area. So the principle's the same. Support well. Caterpillar walk the top of the toes, the root of the toes, up the back of the toes, starting right at the root, feel some nice crystals. You can swap hands. And then again the same principle. Pinch the toe, bring it towards you, and caterpillar walk. Make sure you overlap your previous stroke slightly so that you never miss any areas out. Top, the base. Sometimes if the toes are really small, you may not be able to get to the other side unless you swap fingers. Generally, I like to use my index finger for the small toes. Otherwise, you'll be missing quite a few areas out if you try to use your thumbs. Make sure you go right down to the root. The front of the toes represent the front of the head. So this area will represent the front of the head, the teeth, and often useful for headaches, toothache, migraines. This lower part of the toes would represent the sinus areas and working down towards the eyes. The toes are probably the most time-consuming part of your treatment. I suggest if your client suffers from headaches that you go over this area once, and hopefully you'll have enough time when you've completed the treatment to come back and work on them again. Is it painful? Okay. No? Okay. So you'll work up. Make sure your nails are nice and short so they're not digging into your client. Be careful if your client has any corns on the front of the toes that may be painful. You may want to avoid the pressure. Same if your client has any bunions. Avoid the pressure if it's painful. Once completed with the toes, keep the area nicely stretched and work on the eyes and ears reflex. Stretch the foot and work right across. From here onwards, I would work every area at least twice. So I'd work the eyes and ears. Followed by the arm and shoulder. Arm and shoulders here. Zone 5 and caterpillar. Often you'll feel quite a lot of crystals here, since this is the area that often we're tense in. But be very careful that what you're feeling is crystals and not the tendons that are underneath. There is a difference. With the tendons, they'll feel like long rope-like structures. The crystals will feel like small grains of sand. Work this area different directions. Can you see how specific I am in the area that I'm working in? And then do the same over the thyroid related area, which is here, and this overlaps the thyroid related and the chest and breast area. Nice stretch. Caterpillar walk. Follow the contour in an upward direction, and then where you need to concentrate, go across in as many directions as you can. Note there's very little movement in my joint. And I can change directions. I'm now going across to help to break down those crystals. If you find you're not sliding too well, you may need a little bit more talcum powder. The more talcum powder you have, the easier it is to glide. And at this stage, you would cover the foot. Don't lose contact. You go to the other foot and you would do the same. So the procedure would be apply the talc, then caterpillar walk over the top of the toes, across the base of the toes, up the back of the entire toe, and down the front. Continue with the rest of the toes. Stretch, and you would do the eyes and ears like we did with the other foot. The arms and shoulders in different directions, and the thyroid related area. Once you've completed that, again you will cover your client's left foot, come back to the right without losing contact, and we're going to go on to the crisscross. If you need to apply more talcum powder, bring the talc to your hand. Apply and continue. We're going to crisscross the entire area from the eyes and ears all the way down to the diaphragm. So we're going to stretch and we're going to crisscross at an angle. Make sure you don't just keep staring at the feet. Keep looking up at your client to see whether they're comfortable, in pain, whether they're relaxed. Let me know if you need a change of pressure. Now, can you see I'm coming up at an angle and crisscrossing from side to side. Once I've covered that entire area, from the eyes and ears all the way down to the diaphragm, I'm going to continue crisscrossing, but straight across now. Overlapping my previous stroke slightly. So when I finish a movement, I will keep my hand there, use it to stretch the skin up, and continue with my other hand. This way I'm ensuring that I'm not going to be missing any areas out. Is that too firm or too light? Okay. Going to go straight across. I'm now on the waistline. reaching the heel line. Once you've reached the heel line, you can continue alternating hands, or it may be easier if you just use one hand to go across. So one hand to support, the other one to crisscross. Later on, I will show you some additional techniques so that if you have really hard skin by the heel, you can use some knuckling, and this will be a deeper technique that will enable you to access the reflexes beneath. Go right underneath the heel, and then once completed, you could repeat this again so that you do this twice, and then we're on the urinary system. The urinary system incorporates of the bladder, which is a slightly puffy area above the heel line, the ureter tubes that lead up into the kidneys and then back down. Stretch the area and work the bladder in different directions. The urinary area is a really good area in reflexology to concentrate on, since it's the area that gets rid of all the wastes. So work the bladder different directions, then stretch, work up the ureter into the kidney. Kidneys can be a little bit tender. Work the kidneys in as many directions as possible, remembering you're aiming to remove wastes. You can swap hands for different directions. And then what you need to do is keep the area stretched and drain everything down from the kidneys into the bladder. I would do this several times to just drain down. At this stage, you would cover the client's right foot, go over to the left, not losing contact, and you would repeat what we have just performed on the client's right foot. So it would be crisscross at an angle all the way down to the diaphragm line, and then straight across, caterpillar walking from the diaphragm line down to the heel. Once completed, you would work the kidney and the urinary system. So the bladder, several directions. You'd then work up the ureter tube into the kidney, work the kidney in several directions, and then drain downwards several times. At this stage, you would then reveal both feet, and this is when we would perform the work on the colon, which is very good, especially if your client has problems with digestion, with constipation, or you